It was perhaps only a matter of time before the huge number of coronavirus cases that have swamped Indian hospitals spread beyond its borders. Nepal is now struggling in just the same way with oxygen shortages and patient overload. There are nearly 30 times more infections than a month ago, and all the while, the distressing sight of more and more funeral pyres.
In this holy site on the banks of the Bagmati River, there is a new, distressing daily ritual. Dozens of bodies are being brought here every day, all COVID victims, afforded some dignity after a desperate death. The virus spread from neighbouring India and has continued its rampage through Nepal's border area, including the capital Kathmandu. Doctors in this small and impoverished nation say they don't have the means to cope.
I get at least 20-30 calls a day asking for beds, asking for ICU beds, ward beds, asking for ventilators, inquiries and also. And most of them, we just have to say that we have no beds.
Dr. Pandey says some parts of the country have a 90% infection rate. In March, there were around 100 cases a day. Yesterday, they reported more than 9,000. Her hospital is already at triple capacity, and if they don't get more oxygen soon, she fears there could be a mortality rate to match.
The cases are still going to rise, and as the cases rise, already our death rate is going up.
The Nepalese Prime Minister has been accused of failing to plan for this second wave. He was forced to beg the international community for help. China the first to respond, sending oxygen tanks and ventilators. So desperate is the need for oxygen, climbers on Everest are being asked to donate their unused bottles. Tourism is so vital to Nepal, they couldn't remain closed for a second year. But despite strict checks at base camp, the virus did reach the world's highest peak, and several people were airlifted to hospital. This variant from India is spreading, indiscriminate of fitness or age.
मैले चिनेकै मान्छे यो हप्ता मात्रै 7 जना बितिसक्यो हैन मेरो साथीको दिदी बित्नुभयो मेरो साथी 33 वर्षको भर्खर 33 वर्षको साथी नै हो उ पनि 2-3 दिन ज्वरो आयो भन्यो त्यसपछि हस्पिटल जाउँला भन्दा घरमै निको होला कि भनेर कुर्यो घरमा निको भएन हस्पिटल जाँदाखेरि उसको डेथ भयो.
Aid organisations are battling on several fronts to spare Nepal from complete disaster.
If we do not do more and do it fast with supporting medical services, supporting preventive measures and vaccination, this could exceed the situation in India or reach and exceed it as well.
They stoke the fires, preparing for the worst. In Kathmandu, the sound of sirens echoes all day long, and the smoke of too many deaths hangs heavy in the air. Debbie Edward, News at 10.